Hello, I'm Pharmacist Virginia, and today I'm going to answer all the questions that you have about magnesium sulfate paste. First, what is magnesium sulfate paste? It is a mixture of magnesium sulfate powder and glycerol, which is like a sticky, sugary liquid. And there's also some phenol. So the phenol helps the glycerol and the magnesium sulfate powder mix together so that you get a paste. This is why when you buy magnesium sulfate paste, you might find that the layers have separated. So you have the magnesium sulfate powder and the glycerol separately, and that's why you need to use something clean like a stainless steel butter knife and mix it together so then you get a paste which you can use and put on your skin. Does magnesium sulfate paste hurt when you put it on your skin? No, magnesium sulfate paste should not hurt when you put it on your skin, and it does not sting. Magnesium sulfate paste draws out anything that's stuck in your skin, like any pus from a boil, a splinter, or an ingrown hair. When you put it on and you leave it to work, you won't feel any pain while it is drawing out any pus, the splinter, or the ingrown hair. So it's sometimes called a pain-free way to remove a splinter, any pus, or an ingrown hair. What does magnesium sulfate paste look like? You have the clear, colourless glycerol liquid, and you also have a white magnesium sulfate powder. These layers often separate when they're in the pot, and that's why you have to mix it up in order to get paste. The paste is white and it looks like it's got breadcrumbs in it, but that's because that's the texture of a paste. You've got little bits of powder inside the liquid glycerol, and that's what helps to draw out anything like pus, an ingrown hair, or a splinter from your skin through osmosis. So how does magnesium sulfate paste work? It works through osmosis, and that means it helps water carry anything with it out of the skin and to the surface of the skin. Can you use magnesium sulfate paste on an open wound? No, you should not use magnesium sulfate paste on an open wound. You should only use magnesium sulfate paste on skin which is closed. This means that it's not bleeding and it's not weeping or anything is coming out of it. So if the skin is closed, like a boil which has pus stuck underneath, and you can see that it's quite yellow on the outside and the skin is not broken, then you can put magnesium sulfate paste on top to help slowly pull the pus out from underneath the skin. This is also why if you have an ingrown hair, you might have the hair that you can see, it's normally like a black line or whatever colour your hair is, it will be like a line underneath your skin, and you can use magnesium sulfate paste on your skin to help to pull the hair out. You can also use magnesium sulfate paste to pull out a splinter. So this is anything like a small piece of wood or metal or plastic or glass or even broken china or anything from the garden like a natural plant such as a thorn or a cactus hair or a thistle hair or any nettle stings. You can use magnesium sulfate paste on the skin in order to pull those out. How long does it take for magnesium sulfate paste to work? It can take about 6 to 12 hours after the first time you put magnesium sulfate paste on your skin for it to start drawing out any pus or slowly pulling the hair or splinter to the surface of the skin. You might have to apply magnesium sulfate paste around 2 or 3 times a day for about 2 days in order to pull out whatever you are trying to take out from the skin. If it takes longer than 2 days to try and pull it out with the paste, then please see your pharmacist or another healthcare professional for advice on treatment. What do you use magnesium sulfate paste for? So, it's to help remove anything that's stuck under your skin in the upper layers of the skin. So anything that is deeper than a few millimeters into your skin, then you should not use magnesium sulfate paste. Anything that is an open wound, you should not use it. And anything that looks like it might be infected, so this means that it's weeping or it's bleeding or it's very hot and itchy skin, then those are all signs of an infection. And if you have a high body temperature or a fever, then that's another sign of infection, so you should not use the paste. If you have a spreading rash, you should not use the paste either, as the paste is not meant to help heal a rash or any kind of skin infection apart from something like a boil or an ingrown hair or a splinter. Where can you get magnesium sulfate paste? So, you can get it from any pharmacy that's nearby in the UK. Most pharmacies will have a small pot of magnesium sulfate paste, and it's normally about £3 to £7. When should you not use magnesium sulfate paste? You should not use it for anything that is stuck in the deeper layers of the skin. You should not use it on an open wound, and you should not use it if you are allergic to any of the ingredients. The 3 ingredients are magnesium sulfate powder, phenol, and glycerol. If you are pregnant or have any skin conditions, then please speak to your healthcare professional before you use magnesium sulfate paste. Does your skin absorb the magnesium sulfate paste? When you put magnesium sulfate paste on your skin, it will not go into your skin. It will stay on the surface. So there is no need to rub in the magnesium sulfate paste. Simply place it on top of your skin and then put the dressing on top. The dressing will help to absorb anything that comes out of your skin, and also it helps to keep the magnesium sulfate paste on your skin, and this provides a place for osmosis to happen. So remember, this is water and anything else that you want to get out of the skin coming up from the inside of the skin, the upper surface levels of the skin. They go up towards the magnesium sulfate paste, which is a concentrated layer that attracts water, and it's also just outside your skin. So it works as a drawing agent to draw things out of the skin. Is it bad to leave magnesium sulfate paste on your skin for a long time? Generally, it's not bad to leave magnesium sulfate paste on your skin for a long time. This is because it's a concentrated layer that does not get absorbed on your skin. If you leave it on for a long time and your skin starts to get irritated, so anything longer than 6 to 12 hours, then it might mean that your skin is sensitive to magnesium sulfate paste and you should wash it off. If you do have an allergic reaction to magnesium sulfate paste and your skin feels really itchy and painful after you've used it, then you should not use it again in future. Magnesium sulfate paste is something that you only use for a short period of time. You apply it about 2 or 3 times a day for around 2 days. You should not really use it any longer than that unless you have seen a healthcare professional like a pharmacist or a doctor to get their advice on how long you should use it for. Can you use magnesium sulfate paste for an ingrown toenail? If you have an ingrown toenail and you're starting to see the corner of your nail become red, puffy, swollen and filled with yellow pus, then you can put some magnesium sulfate paste on top to help remove that pus. After you remove the pus, you should put some antiseptic on top. This should help reduce the chances of you getting an infection. If your ingrown toenail is still hurting a lot and causing a lot of pain, then you may need to see your doctor or pharmacist to have a look at it, or ideally a podiatrist, who is someone who specializes in the care of your feet. So you can use the magnesium sulfate paste to help relieve pain from an ingrown toenail. And ideally, you should go and get it checked out. Instead of digging out a splinter with tweezers, you can use magnesium sulfate paste, which is a pain-free way to get rid of a splinter, an ingrown hair, or even any pus out of a boil. Simply pop off the lid and use something clean, like a stainless steel knife, to mix it up. Then you'll get a nice gooey texture, just like this. Take a small amount and put it on your skin where you want to extract the splinter or the pus or the ingrown hair. Then simply put that to one side and get a plaster and put it on top. You can do this about 2 to 3 times a day for 2 days. If you can't get it out, then see your pharmacist for further advice. This paste is just for things which are stuck on the upper surface layers of the skin. Anything deeper than that, then see a healthcare professional for treatment advice.